represent the official views of PCORI. Aside from that, there's no conflicts that I have to disclose. And just want to go over the objectives. So as you might be aware, this is the first part of a two-part series of webinars. This first part is going to discuss the physical and social effects of COVID-19 on the Hispanic and Latino community here in Ohio. And we're going to discuss the impact of COVID-19, the pandemic, on the mental and behavioral health of this community. So that's going to be part one. And then part two I have some objectives listed there. I will cover that in the webinar that is scheduled for the same time next week.
Marilyn, I think it's a good opportunity for us to present the polls to the participants.
Oh,
three
sure.
short poll questions the participants will see on their screen. I will send the first one over there. They're all true or false questions. The first one reads: Hispanic and Latinx represent less than 5% of the population in Ohio. That again is a true or false question. Participants can enter the questions just by clicking on the screen their answer. Once again, Hispanics and Latinx represent less than 5% of the population in Ohio. That's great. Thank you, everybody, for answering this question. Moving on to our next question, it will be: Hispanic and Latinx report significant concerns regarding mental health and behavioral health during the COVID-19 pandemic. That again is a true or false question. Once again, the question is: Hispanics and Latinx report significant concerns regarding mental health and behavioral health during the COVID-19 pandemic. Thank you once again for your answers. And our next and last question before continuing with Marilyn is: Hispanic and Latinx have higher COVID-19 cases, hospitalization, and death rates compared to non-Hispanic Latino groups. Once again, this is a true or false question. The question reads: Hispanics and Latinx have higher COVID-19 cases, hospitalizations, and death rates compared to non-Hispanic Latinx groups. Thank you once again for participants for their answers. And with that, we conclude our pre-test section of this webinar. Thank you, Madeline.
Thank you. Thank you all for participating in those poll questions, and we will get to the answers towards the end of the presentation. So again, these are just the objectives that we're going to be covering today, and then some of the objectives that we're going to be covering in the next webinar. I want to acknowledge some of the team members that made this project possible that we're going to talk about today. And we spanned a variety of different partners here, from the University of Cincinnati, Cleveland Clinic, Marty, University of Toledo, the Ohio State University, and we had 2 former project coordinators who were instrumental in this project. And again, want to acknowledge the Ohio Latino Affairs Commission for their involvement in facilitating the study. So before we begin, in terms of talking about Ohio specifically, I just want to go over COVID-19 disparities in general. So what we see on the slide here is basically, if you look at the right-hand side of this slide where we have cases, you're going to see the darker the orange, basically, those are states that have a higher proportion of Hispanics or Latinos who are testing positive or who are confirmed cases with COVID-19, and higher than what you would expect given their representation in the population. So basically, based on the number of Hispanic and Latinos who live in that particular state, they're testing positive or have confirmed case rates at a rate that's higher than what would be expected. On the left-hand side of your slide, you have this also represented for death. So in states that are kind of that yellow or orangish color, those states also are having a higher percentage of deaths among Hispanics and Latinos compared to what, again, you would expect given the representation in the state. So what this basically tells us is that for many states, they are reporting higher percentages among Hispanic and Latinos in terms of COVID-19 impact compared to what you would expect given their representation. And when we look at, you might be saying, okay, well, that's national data. What about some just like more very like specific data to a certain locale that maybe has a large percentage of Hispanic and Latinos? So we're going to look at this study from Jacobson and his colleagues. And basically this team looked at COVID-19 disparities in a Medicaid managed care sort of database. So it was specific to Northern California. And what they found is that Latinos, again, had a higher positive test rate, had a higher rate for hospitalization and higher death rate compared to all other racial and ethnic categories. Now, the reason why this is important is because this was a Medicaid managed care database. And so you would think that some of the differences in terms of socioeconomic status would be reduced. So we don't have as much variability there. So that's something, that factor is sort of eliminated. But even if you control for that, you still have a higher representation among Latinos in terms of this data. Again, sort of demonstrating the disparities in COVID-19 among this particular community. We also know that just like national data shows us that Hispanic and Latinos have been adversely affected by the COVID-19 pandemic in terms of financial and economic stress. So at one point during the pandemic, the unemployment rate was 8.2% for Hispanic and Latinos, which was by far the highest unemployment rate for any racial or ethnic group. And it generally, the thought is that it stems a lot from Hispanic and Latinos being employed in services or sectors, primarily in the service industry, that were really, really hard hit by the COVID-19 pandemic. We also saw that Latina women in particular were affected by unemployment, with at one point early on in the pandemic, 1 in 5 Latino workers were actually unemployed. So again, some really stark data when it comes to the impact financially and economically and occupationally on our Hispanic and Latinx population. In addition, when we look at family and social impact, we know that nationally, again, Hispanic and Latinos have reported more disruption in their sort of day-to-day life, with nationally them reporting that the COVID-19 pandemic has had a significant impact on their daily functioning, with 89% of Hispanic and Latinos sort of reporting that it has posed a threat to their day-to-day life, and also more Hispanic and Latinos reporting that the COVID-19 pandemic has been a stress in terms of their health or in terms of their finances. So seeing it as a threat to those domains. So again, for our Hispanic and Latinos, we tend to see some of these reports have a higher percentage, or they report a higher percentage of people feeling like that these are issues that they're facing. In terms of the physical and mental health impact, we also see some stark data when it comes to Hispanic and Latinos, with Hispanic and Latinos reporting higher rates of stress, anxiety, and depression, and also reporting that they view the pandemic as having a major impact on their mental health at rates that are higher than other racial and ethnic groups. In terms of access to resources, so these would be sort of the support systems that were in place that were meant to help facilitate recovery, right? So thinking about like the, Paycheck Protection Program and things like that. Nationally, Latinos reported that they weren't able to access those support resources as easily or as well as other racial and demographic groups. So, for example, we had some data to suggest that Latinos did not benefit from the Paycheck Protection Program the way that other groups did, or as it was intended to benefit Hispanic and Latinos as well. And again, that's a concern because of what we just sort of mentioned in terms of the economic impact, which is that Hispanic and Latinos work in job sectors or job areas that were disproportionately impacted by the pandemic itself. So this is just sort of the national picture. And I want to just like briefly lay it out because now we're going to sort of talk about Ohio data a little bit more specifically. So in terms of COVID-19 in Ohio, so this is data from the Ohio COVID-19 dashboard. And this data is as of September 11th. So it's about a week or a little bit over 10 days dated. But it looks like we're just showing sort of numbers on cases, hospitalizations, and deaths. And this is across all of Ohio. So what you see is the numbers for cases, hospitalization, and deaths as of September 11, 2021. And then listed below each column are the counties with the highest rates. So you see Franklin has the highest rate of cases again, or number of cases as of September 11th. That might have changed in the last 10 days. Cuyahoga and Hamilton following closely behind them. In terms of hospitalizations, Cuyahoga has the higher number compared to other counties. And then in terms of deaths, Cuyahoga also has a higher number of deaths compared to some of the other counties. Okay, and then when we look specifically at Hispanic and Latinos in Ohio, it's important to kind of see what their percentage or what their representation is in the data as well. So in terms of ethnicity, generally speaking, Hispanic and Latinos represent about 4.4% of the population in Ohio. They represent 3.3% of the cases and then represent 3.4% of the hospitalizations. So compared to our population in Ohio overall of Hispanic and Latinos, and then compare that to the number of cases and a percentage of cases and percentage of hospitalizations, it's about where you would expect it to be. But that still doesn't mean it's not a concern. So it is a concern for a variety of factors, because we know that Hispanic and Latinos already face several barriers and face several structural factors that make them more vulnerable to public health crises, public health emergencies. And so that's something that we need to be concerned about. We also are concerned because, well, the population of Hispanic and Latinos in Ohio is growing. We represent about 4.4% of the population compared to nationally about 18.7% of the population. But the population in Ohio grew by about 47% just between 2010 and 2020. So we are on a trajectory of increased population growth among this particular community. So it's important to examine, the impact of COVID-19 on this particular community. So where do Hispanic and Latinos in Ohio predominantly live? So we sort of have them in certain clusters in Ohio. Now, they are dispersed sort of throughout a lot of different regions, but in terms of the higher percentages of residents, we have sort of the Northwest corridor, which is sort of Toledo area, the Northeast corridor, which is where Cleveland is, which is where I'm actually physically located right now, Columbus, so Central Ohio, that area, and then down in the Southwest corridor, which is where Cincinnati is located. So when you look at the Hispanic and Latino population, these four areas tend to have the higher percentage of Hispanic and Latinos, or higher numbers. But again, we have Hispanic and Latinos sort of represented throughout the state. So we wanted to understand the impact of COVID-19 on our Hispanic and Latino population, because again, it's really important just from understanding the disproportionate impact, which we're seeing nationally, to see if we're seeing a little bit of that here. We're also interested because that population and community is growing. We want to make sure that we're attentive to those needs. So we basically sort of took a step back and said, okay, we have a bit of a problem here. We want to know more specifically what the impact is on our Hispanic and Latino population. So myself and those other partners that I sort of acknowledged at the beginning of this presentation, we decided to think about, okay, so what's the problem facing us, is that we don't have any local data right now, and that we wanted to try and come up with like a shared definition of what that problem is. And this is important when we talk about designing studies or designing research to illuminate the answers to a particular problem. So we sort of came up with this shared definition of we need local data. That was the problem. We also wanted to make sure that we understood, or we're talking the same language when it comes to what are we talking about in terms of effects. So what are we trying to measure, if you will. So again, as a team, we adopted sort of a shared definition of the problem and its impact on the population's health. So in this case with COVID-19, we understood that COVID-19 obviously was the big issue, but we wanted to understand the impact on our community, both physical, mental, social, and economic. So we wanted to cover all domains in terms of the effect. In order to do this, we wanted to make sure that we involve the right stakeholders. So as I mentioned, we sort of identified all of those different partners in those various regions of Ohio. And we worked together to design sort of what we were going to do in terms of measuring or obtaining some of this data. And in the end, we sort of came up with both a quantitative or sort of a survey to administer, and then a qualitative component, which was to do focus groups and really sort of get at the human impact of COVID-19 on our population and on our community. And then with those partners throughout Ohio, we went ahead and implemented the project. And I would be remiss if I did not mention how much of a role some of our community partners, community-based organizations, social service organizations that particularly service Hispanic and Latinos were. They were super helpful in making sure that we tried to get responses from the various regions. They were super helpful in helping us understand sort of their perspective on the impact on our communities. So I want to make sure that I acknowledge them as well. So that was sort of what we conceptualized in terms of the project. And so we searched for funding. So PCORI had this engagement award that was a possibility. And so we applied for this engagement award with the intent to assess and understand the impact of COVID-19 on Hispanic and Latino populations in Ohio, to better assess and understand system features that have aggravated disparities in the context of the COVID-19 public health emergency. And all of this, to be said, is that we wanted to develop recommendations for improving the health for our Hispanic and Latino populations, and also outline recommendations to help facilitate the recovery from the pandemic. So we disseminated the COVID-19 survey to targeted regions of Ohio, and I'll talk a little bit more about the survey in just a second. We conducted these regional focus groups with patient stakeholders who had been involved in other PCORI projects previously, and we facilitated dialogue and communication with those regions around COVID-19 concerns. So those are some of all of sort of the components of the project. So again, in those different regions, we had certain stakeholders that sort of helped lead the effort in that particular region. Just here are outlined those 4 regions again. And in terms of the survey, we use the COVID-19 Exposure and Family Impact Survey. This is a survey that's available from the Center for Child Traumatic Stress, and it was designed to capture family and household impact of the pandemic on families or children. We administered the survey via email or text link, so it was an electronic survey. That will bring up some issues in terms of the limitations of the study, obviously, and we'll talk a little bit about that later, but it was disseminated electronically. And then we disseminated it through regional leads, as identified in the previous slide, our community-based organization partners, and through other key community stakeholders. Our recognition and our understanding is that we wanted to make sure that we worked with the individuals who worked really closely with the Hispanic Latino populations throughout Ohio. So there are community-based organizations and social service agencies throughout Ohio who are boots on the ground doing all the work, who really make it their focus and or their mission to serve and support Hispanic and Latinos in their region. And so we wanted to make sure that we worked with them or partnered with them in some capacity and talked with them to ensure that they were also sort of engaged in this process as well. So the survey results are sort of broken up into these 5 main areas. We look at the health impact of COVID-19, the economic impact of COVID-19, the family and social impact, daily stress or daily hassles caused by COVID-19, and then its impact on physical and emotional well-being. So the survey sort of covers all of these domains, and now I'll sort of present to you some of the data on these domains. So in terms of health impact, what we found was that of our respondents who responded to the survey, 50%, so half of our respondents, reported that they had a family member who was exposed to the COVID-19 virus. We had 20.7% of respondents say that they had a family member who was hospitalized from COVID. 13.5% of respondents say that they had a family member who had been in the ICU. And then 10% of respondents say they had a family member who unfortunately had passed or died due to COVID-19. So when we think about this, in terms of how does this maybe compare to national data? Nationally, Latinos, Hispanics and Latinos report that like a quarter of them, so about 25% of them, know someone who has been infected. And so that's 25% nationally. In our sample, it's 50%, because at least they know one family member who's been exposed. 1/3 who have known someone who has passed, so about 1/3 of nationally, Hispanic and Latinos are reporting they know someone who's passed. So our data says that they have at least, there's 10% of our respondents in our sample who say they know someone in their family who has passed. So this is a little bit more specific and not as generic as do you know someone. But again, it sort of helps us compare to where we sort of fit with this sample compared to the larger national data. In terms of the economic impact, we know that 66.9% of respondents said that they experienced a decrease in their income as a result of the pandemic. 75% of respondents say that they had their hours cut back or reduced as part of the impact of the pandemic. 23.6% who reported that they permanently lost their job, so were unable to return to their job after maybe a temporary absence, or just sort of lost their job from the beginning. And then 16.2% stated that they lost insurance or benefits, again, as a result of losing employment. So nationally, we know that Hispanic and Latinos, 29% of families have reported that their family member lost a job. So again, in our sample, the percentage is much higher. And then 52% of families say that their hours or their pay was cut as a result of the pandemic. And again, here, sort of the complementary question is the second one, the percent with cut back in hours is 75%. So again, a higher percent within our sample. In terms of the family and social impact of the COVID-19 pandemic on our Hispanic and Latino families, 79.3% reported that they had an inability to visit or care for a family member because of the pandemic. 93.6% reported that important family events were canceled. This is really important to note, given that, you know, as a community, as a culture, Hispanic and Latinos place a high premium on things like relationships, family, that sense of community. So these disruptions are really important to note in that context. 52.3% reported that they had to live separately due to health, safety, or job demands. So this might have been someone, you know, who had to live separately due to quarantine or for other reasons. And 19.8% reported that someone moved into or back into their home. So again, some change in the family household, the family residential composition, or family dynamics as a function of the pandemic. To continue with the family and social impact, we also see that 63.2% of respondents stated that they had a worsened ability to care for children with illness or chronic condition. So if you asked, you know, a household or the respondent, they basically said the pandemic made their ability to care for a child with specific healthcare needs more challenging. 65% reported worsened ability to care for other children in the family. So just having a reduced ability or reduced capacity to care adequately for the child. 91% experienced school and child center closures. We know that education and schooling was significantly disrupted during the pandemic, and this number sort of reflects that, with 91% reporting that. And then 69.4% reported a worsened ability to care for older adults, family members with disabilities. So again, you know, all of this data suggests there's a multitude of ways that the COVID-19 pandemic could have impacted family and social factors for households. And this just gives you a sampling of a variety of disruptions, or even just a variety of changes that occurred as a function of the pandemic. In terms of daily stress, so we know that certain individuals in certain households experience a little bit more stress given some of the employment, places of employment or jobs that some of the family members held. So we do know that there tended to be more stress in households where there was a healthcare provider. In our survey results, 24.3% of respondents said that they lived in a household with a healthcare provider, and then 67.6% reported that they lived in a household where someone was deemed an essential worker. So why is this important? Again, the daily stress that's associated with either, you know, inability to maybe stay home, either due to the demands of job or because you lack paid leave or lack sick leave, potentially place more individuals at risk or at increased stress for contracting the virus. So it's just something to note about another contributor to some of that daily stress or those feelings of distress. But other things can cause that daily stress. So we also asked in our survey for respondents to tell us a little bit about things that they had difficulty obtaining. So 15.5% of respondents stated that they had difficulty obtaining needed information. So either information regarding recommendations, safety precautions, or just health information, but basically any information related to the pandemic they had difficulty accessing or obtaining. 30.4% reported difficulty obtaining needed food or adequate amounts of food. That is important because we know that food insecurity, which already disproportionately impacts Hispanic and Latino families, was exacerbated specifically because of the pandemic. 24.3% had difficulty obtaining necessary medication, and 24.3% also reported having difficulty obtaining necessary health care. All of these things are important from a healthcare standpoint because not only are we concerned with the COVID-19 pandemic, but we are also concerned in the illness that results from that, but we're also concerned about people either putting off care or receiving adequate health care because of fears of maybe entering medical facilities or just being unable to access things just because of the amount of stress and the amount of demands on individuals and families. We also looked at physical and emotional well-being with this survey. So we had 66.3% of respondents report that the pandemic made exercising worse. So either like less engagement or just not exercising as much as they used to. 64.7% stated that the pandemic made their eating worse. So eating less or eating more unhealthy was something that we sometimes heard. And then 74% said that sleeping was also made worse by the pandemic. These three behaviors are important because they're health behaviors. These behaviors are related to not only physical health, but they also play a role in mental health as well. We do know that if we, the mind and body are very connected, and if we're not taking good care of one, it's likely to impact the other. In addition, when we're not at our optimal physical health, or we're not physically healthy the way we want to be, that can impact our immune system, which then again plays a role in terms of COVID-19, the COVID-19 virus and its ability to impact someone's physical standing. So those are important things to consider. And then we had individuals also report regarding the impact on their anxiety and their mood. So 83.5% of respondents stated that their anxiety was worse or worsened by the pandemic, and 79.4% stated that their mood was worse or worsened by the pandemic. This data is actually, again, consistent and even in some cases a little bit higher than some of the more national data, where we do see a higher percentage of Hispanic and Latinos reporting higher rates of anxiety, distress, and just depression and stress overall. These numbers are a little higher, but again, it sort of gets to that point of the mental health impact of this pandemic, both early on in the pandemic and as we move forward, is something that we're going to need to pay very, very close attention to. And it's something that really comes out in the qualitative portion of our study, which we'll get to in just a little bit. So when we think about level of distress, so this is just ratings of stress level, we found that for families, for adults, they would rate on average scale from 1 to 10, with 10 being the highest level of distress you could imagine experiencing. Their average rating of distress was 7, or roughly 7. And then we asked respondents to rate their children's level of distress, and on average, they rated their children's level of distress as a 6.7. Again, when we look at this from a national standpoint, there was some national data to suggest that Hispanic and Latinos, if you ask them to rate their stress related to the pandemic, they do tend, I think about a third of respondents in that particular survey rated their stress at like an 8 or higher. So again, our data mirrors or just slightly is under those findings when it comes to Ohio specifically. So the survey also had these open-ended questions at the very end that just asked folks to tell us about the impact of COVID-19 on your children, both negative and positive. So what were some of the impacts? The survey portion, only captures a little bit of some numbers, right? These questions were more open-ended, so it allowed you to put anything in there. So I'm just going to work through a couple of samples of some of the responses just to kind of give you a sense of what was on the mind or what was reported by some of our respondents. So we had one respondent report that, in terms of negative impacts, it was stress, thinking the worst, and counting pennies. Another respondent who said stress, anxiety, boredom, and excessive use of electronics. Another respondent stated that they lost a lot of hair and they had a lot of difficulty sleeping. And another respondent, stated that they fought more and they were worried because, they weren't able to go to school. So, again, just sort of a snapshot of some of the responses, and we'll continue. There's quite a few here. This was also noted in those open-ended responses. Due to unemployment, my daughter suffered migraines. My husband was unemployed for a while, created stress and anxiety of the unknown. Another respondent stated, my children are frightened and get anxiety when we hear coughing or sneezing. I had to be on antidepressants. I felt frightened of losing my loved ones. I started drinking heavily to calm the fear. I gained 40 pounds. Everyone gained weight. We wouldn't let the children out to play for fear of the virus. So here, again, sort of talking about the stress, not only taking a physical impacts, related to this individual who was reporting migraines, but then also sort of looking at some of the other impacts of stress, such as, maybe turning to not the most healthy ways of coping, like drinking more, and then concerns about, putting on weight during the course of the pandemic as well. My 11-year-old grandson missed his friends from school. He became more quiet and withdrawn and was scared that his mother or I would get sick. Again, this sort of alludes to a lot of the concerns regarding mental health and sort of just that change in your normal sort of day-to-day experience, right? And that being really hard on children. Children who are unable to see their friends or socialize at school may, feel more isolated and become more quiet and withdrawn. So this grandparent, it appears, reported that. It was our daughter's senior year and she missed out on prom, graduation, and our family spring break trip to some state. Also missed out on her final in-person days of high school and the beginning of her college experience on campus. So this quote just sort of gets to that disruption and missing those really important events, which we know was something significant that a lot of individuals had to deal with. I know that folks really got creative, or they tried to be pretty creative in terms of trying to create birthday celebrations, but things were just different. And it was very hard to sort of, for a lot of, especially our teenagers, to experience those milestones in such a drastically different way. So this person wrote that their daughter was ill, and so was their niece and the niece's husband, and they weren't able to see them, and that they were very sad because their niece actually had to breathe using a breathing machine, essentially. And so, again, this sort of goes to, even when family members are sick and ill, it was difficult to see those family members, either for reasons of, quarantine or kind of keeping socially distancing, or just difficulty, seeing folks in the hospital as well. So this just sort of identifies that as being a concern. And then we experienced some loss in our family, and it made it difficult to gather. We worried about those that needed to continue to work and older parents contracting the virus, friends with COVID, and a few have passed due to the virus. So this person just sort of talking about their personal experience with losing family members and worrying about their parents, older parents who may have been more vulnerable from contracting the virus. And due to work from home, I see my wife and son more than I ever did before. So this is more of a positive sort of benefit. The negative aspect is that my mother-in-law and my mother are unfortunately unable to see their grandson as much due to multiple risk factors. The same is true with my son's grandfathers. And then this individual also wrote, or a separate individual wrote, I do not see my grandchildren. They worry about COVID-19. We also worry. So a lot of entries about the social isolation, the distancing, and the impact of that distancing on family unity and sort of family cohesiveness and feeling close to family members. A lot of references to mental health and worrying, anxiety and stress. So you see some of the negative impacts really coming out, and obviously in some cases a couple of positives as well. On the positive side, children are closer than ever, and we honestly love having them home. So that was one of the byproducts, the positive byproducts of some of the stay-at-home orders, was being able to maybe spend more time together. One positive was being able to talk more. And then this individual wrote, it has been stressful, yet after reading these questions, we have been fortunate that we as a family have not been affected as much. So this person sort of reflecting on their own experience and saying, like, as much as it was stressful for us, it could have been worse. And so I think that, again, some of that can go to coping and ways that we can kind of think and think about and reflect on our experience with COVID-19 in a way that may help us promote more positive mental wellness and things like that. So these were the open-ended responses to the survey. As I mentioned, there are also some focus groups that we did, so we're going to talk about that now. So we basically leveraged established relationships with patient stakeholders. As I mentioned, PCORI is a patient-centered research outcomes institute, and essentially Dr. Martinez, who was sort of the lead on this particular grant, has established relationships with these various patient stakeholders throughout the state of Ohio, because he's worked with them with previous projects. So we leveraged those relationships with those stakeholders, and those regional leads, again, in those 4 different geographical areas, facilitated focus group discussions using a prepared script. So the script was designed to elicit responses in certain topic areas, but then we sort of let the group sort of materialize as is, so naturally sort of flow, naturally sort of go. So as the group sort of dictated the conversation, we just sort of had an initial script that tried to keep us on certain areas that we wanted to try and focus on. And the groups were conducted in Spanish. So the participants primarily preferred Spanish, or noted Spanish as their primary or preferred language. So the groups were conducted in Spanish, recorded, and then transcribed for data collection. The focus group discussions that we were intending to, again, for sort of elicit responses on were in 4 primary areas: beliefs and practices, experiences, impacts, and then coping. So these were sort of the 4 areas we wanted to sort of cover with those focus groups. But again, all of the focus groups were fairly limitless in terms of what directions they wanted to go. If the conversation, went one way, then we allowed the focus groups to sort of lead the discussion. But we wanted to try and get some feedback in these 4 areas. In doing these focus groups and looking at the transcripts, we found that 4 primary themes seem to emerge: the necessity of precautions, increased stressors as a result of the pandemic, experiences of anxiety, stress, and trauma. And then we even found a theme regarding, what were the potential benefits, or what were some of the things that you maybe didn't expect to experience, but would be the positives that you experienced as a result of the pandemic. So time with others sort of emerged as a theme. And so I'll go through some what we call like exemplar quotes, or some quotes that sort of capture the spirit of these themes next. So the first one is talking mostly about safety, but mostly talking about like, are others taking precautions, and sort of wondering and being worried about like, are others taking precautions? Are they taking care of themselves? But that we have to do our parts and follow the rules, follow the precautions, and just try and avoid where possible. So again, sort of getting to that necessity of precautions theme. The second one was sort of related to that, was sort of, my friend told me that I would have a heart attack because when you go out, someone may touch you, they're not keeping distance, and you're trying to be careful, but there might be people walking around as if nothing is going on. So again, just sort of thinking about maybe that stress or that worry or anxiety caused by you're wanting to really stay or adhere to some of the safety precautions, but entering environments where you don't necessarily know if others are taking those same precautions, or seeing folks not taking those same precautions, and the anxiety that it might cause you. Loss of affection. So this was a big one in terms of a theme that emerged. And again, in context, our Hispanic and Latino community and our culture, again, puts that premium on connectedness, family, relationships, personalismo, all of those things. So not having that affection, or not having that connectedness and closeness would have potentially a big impact on this group. And we see this with this quote. So this person said, I miss the hugs, the greetings, the kisses, the spaces where we gathered. And this person also said, there's no feelings of freedom. You feel a little isolated. And it has affected me a great deal in my friendships and in society. We are losing like that warmth, that love, that friendship. So again, that loss, and with loss, any kind of loss, there is a experience of grief that comes along with it. And again, for a cultural group that heavily relies, again, just broadly, that tends to heavily rely on those close connections, that can feel really, really, really impactful. So we also saw school stress as being something that came out a lot. Again, for a lot of people, I think, again, 91% of folks stated that their schooling was disrupted or childcare was closed. So you did have more demands on parents in terms of schooling, and we see some folks sort of talk about that. So this parent was experiencing challenges with online learning, like they were having trouble navigating like the internet and opening up different pages. And then they started to sort of lament feeling like they couldn't help their child as much as they wanted to, and finding it really stressful because as much as they want to help their child, they also, just want them to do their best to learn and to not fall behind more than they already are, because this parent also notes that their child was already struggling a little bit. So, that I think really sort of tugs at your heartstrings a little bit, because you have this parent who, is really trying their best, but is struggling in terms of how to best help their child. And echoing stress over helping their child with school. So struggling with like that difficulty of balancing, like wanting your child to be home so that they're safe, and but then also wanting their child to get the most out of education, if you will. So sort of, this parent sort of talks a little bit about the struggle between, both of those things, wanting them to be home safe where where they are, and they're sort of, isolated, but then also recognizing that maybe there are some challenges with their education when they're not in person in school. And this person said at the very beginning, they struggled a little bit because there wasn't a lot of organization. So if you all recall, back in March 2020, which seems so long ago, but March 2020, when we sort of started to shut down, there was sort of a rapid movement to do that. And so with that came, not necessarily likely the most organization. As much as teachers and schools tried, everything was sort of thrown for a loop. So this parent just sort of mentioned struggling at the very beginning with that. It's since gotten better. And this parent just sort of emphasizes that making sure that you stay in like communication, and the teachers being in good communication with the parents is helpful for kids. So just something important, as we continue to move forward, is thinking about that ongoing communication and how that's been helpful. We also had some folks who identified technology challenges, right, with being able to access information, with being able to access resources and things like that. This individual says, because a lot of older individuals, they don't, use Facebook yet, or they don't use technology in general, right? And then this person sort of states that in English. Similarly, not everyone has smartphones or even internet. Even those who do, they might not know how to use them well, like my parents. So it's hard to do everything online now. And so certainly, I think, the move towards the rapid move and the necessary move towards a lot of things being online and needing to rely on internet and broadband access pose challenges, not only for individuals who maybe didn't have that constant access to broadband and internet, but then also if they did have access, but maybe didn't utilize technology as much, struggling with just navigating that technology, which can make accessing information, accessing resources and help, more challenging. And this is another sort of indicator of sort of those challenges. My youngest sibling, who was 6 years old at the time, had to do virtual learning, which was difficult for my parents to navigate in terms of them being able to communicate with teachers, understand and help with homework. They had limited access to the computer, thus it had been challenging for my brother to continue receiving care from the school psychologist and speech therapist. Luckily, I have been able to help my mom with communicating with his teachers and others, helping with his schoolwork and helping provide access to a computer. So I think this is important because this is a good quote that sort of also outlines the demand that maybe was also on older siblings, so teenagers or young adults, to help families, help younger siblings with online learning. And I'm a psychologist by training, and I work as a pediatric psychologist. And for some of the teenagers I've worked with, that was something that was echoed, was feeling like a lot was falling on their plate, and they had to kind of step up in a lot of different areas that they weren't necessarily used to, because they needed to help their younger siblings with school while also balancing their own schoolwork, while also balancing maybe helping their parents out, learning how to navigate some of these things. The other thing that I think is key here is they're mentioning that it was challenging for their brother to continue receiving care from the school psychologist and speech therapist. When you did have those stay-at-home orders and we were, things were shut down, there were questions about how would children who needed special education services or needed certain special services would be able to access those services in that online virtual environment. And in some cases, I think, some of that, there was significant disruption for some children in that regard. So I think that's important to highlight as well. And then this was probably the most stark theme that emerged from these focus groups was the experience of anxiety, stress, and trauma. So in this particular first quote, it's a parent who basically says, it's been affecting I think their daughter, it seems from this quote, their daughter, and then their daughter's attitude then affects the parent. So it's sort of like a chain, right? And I think that's important because like how our children and how our parents sort of cope with all of the stress does play off one another, right? So if we have children who are experiencing significant, behavioral or emotional, challenges as a result of the pandemic, that's likely to impact parents and vice versa. So it really sort of alludes to that issue. And then this, this one saying that the anxiety just basically was so much they never experienced anxiety like this before. And I think again that sort of notes that this unique experience, right? Like we have not experienced a pandemic, in this lifetime necessarily. And so really experiencing something that wasn't typical or hadn't been something that they were familiar with, even though they've struggled with anxiety before. This individual said, like, for me, it was really traumatic. I'm the person who already suffers from anxiety, but it was even tough for me. In my family, I had 3 close relatives die from COVID. But what really affected me was that they were worried about their mom, who had spent time with a family member who was infected, and the mom suffered from diabetes and osteoporosis. And so just that increased their anxiety, basically worrying about their mother who has some comorbid conditions that place her at a higher risk of vulnerability to COVID-19 and being worried about, it sounds like, about her potentially contracting the virus. And this is about a child who is anxious, but is just more extreme because they can't go to school, they can't see anyone, they can't go anywhere. So the anxiety for this young girl was just terrible. And again, this goes to that idea of that isolation and what that causes and how that exacerbates feelings of anxiety and stress. And in this particular case, it's for a young girl that they're still talking about. I think the last part of this quote is also really important. The mother mentions that she still doesn't know how to handle these emotions well. So trying to navigate or help a child who is suffering from anxiety because of a lot of the isolation, but then also keeping in mind, like, that they're at an age or maybe a developmental stage where they're not equipped to necessarily handle these emotions well, but are being inundated with these really intense emotions. So I think that's important to note too, that we think about a lot of younger children likely experiencing some issues from an emotional behavioral standpoint, that developmentally they're not necessarily equipped at that point to handle those kinds of emotions at that particular time. And then in terms of access to support, so we talked a little bit about nationally, Hispanic and Latinos reporting that they maybe weren't able to access some of the supports that were available. In this particular exchange, the facilitator of the focus group basically asked if they lost their job, if they received any assistance from the government. And sort of as a cohort or as a collective, a group of individuals, they sort of said, no, we didn't get anything. There was no help. And then one individual said that specifically because their job wasn't considered essential, they didn't really receive anything. No, they didn't receive unemployment. And what I have learned in terms of doing more research on this is there were some instances where individuals might have been eligible, but they thought they were not eligible, or they were unable to navigate the process of obtaining those supports. And so, even when they were eligible, the navigating of that was just challenging and difficult, and for some individuals, just a complete barrier. And so folks were just not able to access the needed supports, eligibility, whether they were eligible or not. A lot of folks reported difficulty even just accessing them when they were eligible. But we are a resilient group. So we've highlighted a lot of the struggles that folks have outlined, not only just from a number standpoint with the survey, but really looking at some of the human impact, in their own words, in their own voices, like what has this experience been like? And that, was really important to us to capture from the focus groups in terms of the adverse outcomes or the negative impacts. But we also wanted to sort of capture in their own words and their own voices some of the ways that they've been able to cope or get through the pandemic. And the goal was hopefully by identifying some of those things, we would be able to identify things that might help with recovery and make recommendations around it for recovery. So we are a resilient group. And so one of the first ones was, they dance, they put music on in their room, and they play with their grandchildren, and that has been like really, really helpful for them. And they also watch videos where it looks like they preach or talk about God, and that's also been helpful for them. In addition, this other individual reported that, they use video calls to talk with family members. They also dance, and they also are doing more walking at work. And so that's actually a really important thing, because again, when we sort of shut down, there was a lot of sedentary behavior, unfortunately, that likely resulted from that. And so just even, getting up and walking, getting some activity level in can be helpful. And so this individual sort of outlined that. And I like this, make sure I didn't skip one. Yeah, and so I like this quote, this first one, because, they really are talking about valuing the time and valuing quality time, specifically with their kids, and focusing a lot on their children, maybe in a way that they hadn't before. And that's something that came out a couple times in this focus group, was either being more involved or like more engaged with their children in a way that they really hadn't been able to because of the different demands and the different environments that they were in. So with children at school all day long, maybe not being as aware of what's going on with their children all the time. And so the time at home allowed them to maybe spend more quality time and do things that were, more unified as a family, and allowed them to sort of spend more time together and really support one another. And so they highlighted that. This other individual wrote that they've actually been more involved with their child's school. So that's something that was a positive that sort of came out of the study, was the ability to be more involved. They sort of just mentioned that, previously with school, they hadn't really known what was going on with school. Like obviously their child was going to school, but didn't really maybe know the details of like what they were covering or what the content was. And this parent feeling like they've been more involved in that process, and they're just a little bit more familiar and involved with their child's schooling and their education. And I really like this particular quote, this first one here. This person said, we also learn to value more, right? To value more, to not take anything for granted and know that anything can happen and that we have to be prepared, but not to let like the anxiety take over and to try and focus on moving forward, because at the end of the day, there are things that, you can't really control. And so you have to let some things go. Because if you can't solve them, what are you going to do? You're going to hold on to it. That'll give you more anxiety, more stress, you'll worry more, but you have to just let things happen and trust God. And so I think this quote really sort of captures a different mindset in terms of how to think about this, right? It sort of sounds like, being in the present, sort of trying to be mindful and really trying to let go of things that you can't control. And that's an incredibly, important idea in the context of the pandemic, where a lot is out of our control, right? Shutdowns are sort of out of our control. Whether your child, is able to go to school 5 days a week is out of a parent's control, depending on school regulations and things like that. Whether you're, able to, whether your hours are cut back, likely, beyond your control as well. So a lot of aspects of this pandemic that are not in our control, and learning to sort of figure out, how do I sort of roll with some of the punches? How do I sort of go with what's happening instead of trying to maybe fight against it? And this quote also, I think, just again highlights from a cultural perspective and this family's the role of God in this particular family or in this particular individual's life. So really sort of that idea of trusting in God and sort of letting your trust in God sort of help assume that, things will work out how they're supposed to work out. So sort of that value there. And then for this individual, just saying like that they're more united as a family. And for them, they feel like the pandemic has actually brought them everything. Feeling like, maybe this has been a really good experience for their family. And that's something that I think, we can all sort of find maybe some benefit, we call it benefit finding, but looking for some positives or looking for some benefits that may have resulted from this pandemic. And that's going to be important, because the pandemic is not over. And so as it continues to wear on, and I know we're all tired, and I know it's been a long haul, but as we continue to move forward in the pandemic, what are some of the things that we can hold on to that we can point to as being like, you know what, I had that actually worked out in my favor, or that actually I was able to turn that negative into a positive in some way. Really looking for some of those lights of hope, if you will. So I want to just mention that the report has all of these results and goes into a lot more detail, is available at the following link, which should be available in your handout. But basically, the report covers all of the data that I just covered, but then also goes into a little bit more of the national data to kind of give you the backdrop and the context for some of the things that we talked about today. And it's available through the Ohio Latino Affairs Commission website. And then, so what's next? So really we want to focus on recovery and equity, because we've now just spent the last hour or so talking about the impact of the COVID-19 pandemic on the Hispanic and Latino population as of December, basically like 2020, right? Yes, so we collected all this data, which I did not actually mention. We collected all of the data between October 2020 and then November 2020. And then we started working on the report early 2021. So really all of the data here is from the late part of the year of 2020. Of note, this data does not include any reference to vaccinations, because at the time vaccinations were not yet available, and they weren't really as present in the lexicon of like what we're talking about in terms of addressing the pandemic. So we don't have any data related on how they felt maybe about vaccinations or vaccine uptake. We will talk about that in terms of recommendations, but I just want to make that note because I failed to mention that at the very beginning. But in terms of that, including vaccinations as a part of recovery and equity, frankly, that's what we want to turn to next. We've talked a lot about the impact, and now we sort of talk about what is recovery and equity really going to be focused on. And what I'm going to be doing in the next session is really sort of focusing on helping folks understand the structural factors that have been at play, not only now with the pandemic has only heightened the existence of all of those structural barriers and factors that have really placed our Hispanic and Latino community at increased risk. But those factors have long been in existence. And so in order to really focus on recovery and equity, we really have to think about and understand what has been in place for a long time in terms of what are those structures, what are those factors that have really contributed to this disproportionate impact on Hispanic and Latino communities. And only when we understand those factors will we be able to adequately cultivate and promote recovery for the Hispanic and Latino population and promote equity for them moving forward. And we have to do that in a culturally relevant context. So we're going to talk about Hispanic Latino culture, but then we're also going to talk about the history of inequity for the Hispanic Latino population and things that we can do to try and help move forward in a way that is going to be most beneficial for our population. So for part 2 of the presentation, which is again scheduled for the same time next week, Wednesday, the 29th of September, we're going to identify structural and social factors driving COVID-19 health disparities among the Hispanic and Latinx community. We're going to outline recommendations for recovery in a culturally relevant context. And then we're going to outline recommendations to promote mental and behavioral health equity for the Hispanic and Latinx community. So again, definitely, we're just going to talk about this in a way that's really going to hopefully set up the future for benefit for our Hispanic and Latinx community. And so that'll be our next session. And so with that, I will turn it back over to Angel to do the poll question results, I think, and then I have some time for questions and answers.
Excellent, thank you, Marilyn. I think we have space to open up for questions, so participants can feel free to reach out through the question sections. I'm more than happy to read them out loud and help Marilyn answer any and all questions.
Yeah, so if anyone has any questions, feel free to throw them in the question box. Angel will make sure I get them. And then
as for you mentioned the poll questions, we can also share those result now. We have, for the first question, Hispanics and Latinx represent less than 5% of the population in Ohio. We had, where a majority of stating 67% as false.
And that is actually, they represent about 4.4% actually of the population. So Ohio is actually one of the states that has the lowest like per capita percentage of Hispanic and Latino populations, but also has one of the faster growing Hispanic and Latino populations. So yes, we represent a very small percentage, but we're a growing population, and that percentage will change. But in the last census done 2020, the one that we just recently filled out, it looks like we account for about 4.4% of the population, compared again to the national population, which is about 18.7%.
I am sharing our next question. It read, Hispanic and Latinx report significant concerns regarding mental health and behavioral health during COVID-19 pandemic. And we have a 73% that stated true.
Absolutely. Yep. So obviously in the course of this presentation, we highlighted that several times, either through the survey itself or through the open-ended questions at the end of the survey or through the focus group themselves. Mental and behavioral health was one of the things that came up the most, and frankly was emphasized the most. And so actually, if you look at our report that is available on the Ohio Latino Affairs Commission, when you get to the recommendation section, which is at the very end, it's broken down into recommendations for different areas. The mental and behavioral health area is actually the longest recommendation section in the whole report. And the reason for that is because a lot of the feedback and a lot of the findings really did center around the negative impact on mental and behavioral health for the community. So we tried to outline a lot of recommendations to try and address behavioral health equity, because what we do know is Hispanic and Latinos before the pandemic, they had already a high need for mental and behavioral health services, but the need did not match like engagement or retention in treatment. So Hispanic and Latinos were not engaging in treatment or staying in treatment despite having a really high treatment need. So that already existed before the pandemic. And then the pandemic happened and all of that has just been exacerbated. So, you might have heard that that we're experiencing, we're in the middle of a mental health crisis or behavioral health crisis in this country, and that's absolutely correct. But it's actually a crisis of different levels, meaning that some of our marginalized populations, like our Hispanic and Latino community, are experiencing even more negative impacts from that, because from the starting point, they were already experiencing a lot of challenges.
Thank you so much, Marilyn, for sharing. I have the last question that we share. It is, Hispanic and Latinx have higher COVID-19 cases, hospitalization, and death rates compared to non-Hispanic Latinx groups. We have 95% of the attendees responded true to that question.
Yes, so you guys are correct that I guess, let me take that back. So I guess it depends on what data you're looking at. Generally, nationally, we're seeing a higher rate than compared to some other racial and ethnic groups. If you look at, Ohio, for example, you're not seeing a disproportionate case rate or rate of hospitalization or death rate compared to other demographic groups here in Ohio. But generally speaking, again, nationally, we are seeing a disproportionate impact in terms of confirmed cases, hospitalizations, and death rate when it comes to Hispanic and Latinos nationally. But if you drill down to more local data, depending on the state, depending on the county, you may not see that disparity. But again, it's important to know what the national finding is that in that regard.
With those, we conclude our poll sharing section. We want to emphasize once again that participants can participate through the questions section on your right-hand menu, and we can share those with Marilyn so she can answer all of your questions.
And I do have, here's my contact information. I failed to share that. So if you guys have any questions or any follow-up, thoughts or discussion that you'd want to engage in, you're more than welcome to email me. You can also find me on Twitter. You can also find me on LinkedIn. So whichever format you'd like to connect, I'm happy to answer questions or anything. Or if you'd like to discuss the report or this further, I'm more than available. And then I also have some information regarding, some ongoing things that we're looking to do in terms of sort of follow-ups to this. So we will continue to, not all of the data that we've collected has been presented. There is some data that we haven't yet examined. So we hope to, share that data at a later date. And it's just some small subsets of our data. And then I just want to make sure that if anyone does have questions about the report itself, that you are welcome to contact me. My co-author, Jessica Zimmer, is also, you can contact her as well. And then Dr. Martinez can also be contacted. He is no longer at The Ohio State University. However, he has moved to the University of Texas, El Paso. So I can get you in touch with him too if you guys have questions. But I wanted to make sure I noted that he is no longer at OSU in case you go looking for him at OSU. He took a fancy job at Utah.
Marlene, as of this moment, we don't have questions. I don't know, could you go to the next slide, please?
Yeah,
I would like
absolutely.
to have the opportunity to mention to participants that we hope to see you again on our next section or of this webinar that will be part 2 of the impact of COVID-19 on Ohio's Hispanic and Latinx communities with our same presenter, Dr. Marlene Sampiro, who will be with us next September 29th, this same time, 1 to 2:30. So please make sure to come to our next session. Certificate of participation will be distributed upon the completion of that second part. And we hope we can see all of you there.
Thank you all so much. I do appreciate it. And again, if you do have any questions, feel free to reach out, and I hope to see you guys next week.
Thank you, Madeline. It's always a pleasure to hear from you.
Thank you, Angel. Appreciate it.
Thanks to everybody that connected today. Thank you. Have a great day.